The official numbers for your Medicare costs in 2026 have just been released, and they are higher than anyone was hoping for. This means the amount of money that gets taken directly out of your Social Security check is about to change. And in this video, I'm going to show you the exact official numbers, but here's why you need to pay very close attention. Simply knowing the numbers isn't enough. In fact, just knowing the numbers puts you at a disadvantage. What you really need is a plan. So make sure you watch this entire video, because at the end, I'm going to give you 3 very specific, very simple steps that you must take before the year is over to shield your wallet from these new higher costs. This is the information that can make the difference between a comfortable retirement and a stressful one. Let's get right into it. The number that impacts almost every single person on Medicare is the standard monthly premium for Part B. This is the cost for your doctor visits, outpatient care, and medical supplies. In 2025, you were paying $174.70 a month, a familiar number. For 2026, that number is climbing to $185. That's an increase of $10.30 every single month. Now, that might not sound like a seismic shift, but let's put it in perspective. That's an extra $123.60 gone from your budget over the course of a year. That's a couple of tanks of gas, it's several bags of groceries, it's money that you planned for that is now being reallocated without your permission. You're probably asking yourself, why? Why is it going up again? It feels relentless, doesn't it? Well, the official reasons are twofold. First, the steady, ongoing inflation across the entire healthcare industry continues to push prices up for everything. Second, and this is a big one, is the approval and coverage of new, extremely expensive prescription drugs that are administered in a clinical setting which fall under Part B. Think of certain cancer treatments or injectable medications. These innovations are fantastic for medicine, but they come with a hefty price tag that gets passed down to every single person paying a Part B premium. It's a bitter pill to swallow. You're paying more for services you may never even use. And for some of you, the news is unfortunately even worse. If you are considered a higher income individual, you are subject to something called IRMAA. That's the income-related monthly adjustment amount. It's basically a surcharge you have to pay on top of the standard premium. And in 2026, the income brackets that determine these surcharges have shifted. For individuals earning over $103,000 or couples earning over $206,000, your monthly premium won't just be $185. It will be significantly higher, reaching up to $629 a month for those in the highest bracket. It is absolutely crucial that you look up the new 2026 IRMAA brackets to see exactly where you fall. Ignoring this could lead to a massive, unexpected shock when you see your Social Security statement. But the Part B premium is only the most obvious cost increase. There's another, more hidden cost that can ambush you when you are at your most vulnerable. It's a cost that many people completely overlook until they're handed a shocking hospital bill. I'm talking about Medicare Part A, your hospital insurance. Now you're probably thinking, wait a minute, I don't pay for Part A. I work my whole life, so it's free. And for more than 99% of people, you are absolutely correct. You don't pay a monthly premium for Part A, but free does not mean it has no costs. Far from it. The costs for Part A are hidden inside the deductibles and co-insurance you pay when you actually use the service, and these have all gone up. Let's start with the Part A deductible. This is the amount you have to pay out of pocket for a hospital stay before Medicare starts paying its share. In 2025, that deductible was $1,632. In 2026, it's jumping to $1,660. That's the first bill you have to cover right out of the gate for each benefit period. but it gets more serious. The real financial danger with Part A isn't the initial deductible, it's the daily co-insurance you start paying for longer hospital stays. For days 61 through 90 in a hospital, your daily cost was $408. In 2026, that cost is rising to $415 per day. Think about that. A single extra month in the hospital could cost you over $12,000. And for a skilled nursing facility, the daily co-insurance for days 21 through 100 is rising from $204 to $207.50. These are not small changes. They are financial traps waiting for anyone who faces a serious, prolonged health issue. It highlights the critical importance of having a plan, whether it's a Medicare supplement or a Good Advantage plan, to cover these potentially catastrophic gaps. The rising costs of Part A and B are now officially on the books. They are concrete, calculable numbers, but there is a third, far more unpredictable part of Medicare, where the costs can change dramatically based on your personal needs. It's the part that causes the most confusion and the most financial pain. If you get it wrong, your prescription drug coverage, Part D, and what the analysts are predicting for next year is something you need to be prepared for. When it comes to Medicare Part D, your prescription drug coverage, things get a lot more personal and a lot more complicated. Unlike Parts A and B, which are standardized and run by the government, your Part D plan is offered by a private insurance company. This means there isn't one single official cost increase. Instead, there are hundreds of different plans, and each one is changing in its own unique way. However, industry analysts and the Centers for Medicare and Medicaid Services have released their forecasts, and the trend is clear. Costs are going up. The average monthly premium for a Part D plan is projected to increase by about 6%, but honestly, the monthly premium is the least of your worries. It's a distraction. The real danger, the financial trap that ensnares millions of seniors every single year, is hidden inside your plan's formulary. The formulary is simply a list of all the drugs your plan has agreed to cover, and that list can and does change every single year. A medication that was in a low-cost tier this year might be moved to a higher cost tier next year, or even dropped from the formulary altogether. This means a drug that cost you a $20 copay in 2025 could suddenly cost you $150 in 2026 with the very same plan. This is how people walk up to the pharmacy counter in January and get hit with a bill that is hundreds of dollars more than they expected. It's a devastating surprise. Furthermore, the infamous Part D donut hole or coverage gap is also changing. The threshold to enter the donut hole and the catastrophic coverage limit are both increasing, meaning you will have to spend more of your own money before you get relief. You might be feeling a little overwhelmed right now. The numbers keep going up, the rules seem to change every year, and it feels like the system is designed to be confusing. I get it, it's a natural reaction. You're seeing your hard-earned retirement savings being chipped away by forces outside of your control. But this is not the time to feel helpless. This is the time to get empowered. Remember at the beginning of this video, I told you that just knowing the numbers isn't enough. This is why, because knowledge without action is useless. And I promised you a plan. I promised you 3 specific, simple steps to take back control and protect your finances. These aren't vague suggestions. They are a concrete action plan, a strategy. And executing this strategy is far more important than memorizing the new deductible for Part A. So let's transition from the problem to the solution. The numbers are what they are nepriatony. But now let's focus on what you can actually do about it. Let's build your defense. Here are the 3 steps I promised you. The 3 things you need to do before the end of this year to ensure these cost increases have the minimum possible impact on your life. Think of this as your personal financial shield for 2026. Step 1 is the simplest, yet it's the one that millions of people fail to do. Sometime this fall, you are going to receive a thick envelope in the mail from your current insurance provider. It's called the Annual Notice of Change, or ANOC. Most people see this bulky document, assume it's just boring insurance jargon, and toss it straight into the recycling bin. This is a catastrophic mistake. That document is your personal battle plan. It is a legally required notice that details every single change to your plan for the upcoming year. It will tell you if your premium is changing. It will tell you if your doctor is still in network. And most critically, it will tell you exactly how the coverage for your specific prescription drugs is changing. You must open this letter, find the section on drug coverage, look up your medications, and see what your new costs will be. This single action alone can save you from that shocking surprise at the pharmacy in January. Step number 2 is the most powerful money-saving action you can take. Every single year during the Medicare open enrollment period, which runs from October 15th to December 7th, you must compare your Part D prescription drug plan. I don't care how much you like your plan this year. Loyalty to an insurance company will cost you money. The best plan for you in 2025 is very likely not the best plan for you in 2026. The single best tool for this is the official Plan Finder tool on the Medicare.gov website. It is free, unbiased, and it takes about 15 minutes to use. You enter your zip code, your pharmacy, and the list of your medications and their dosages. The tool will then analyze every single plan available in your area and show you an estimate of your total annual costs, including premiums, deductibles, and copays for each one. The difference between the best plan and the worst plan for your specific needs can often be thousands of dollars a year. 15 minutes of your time to potentially save $1,000 or more. There is no better return on investment for your retirement. Step number 3 is the expert-level tip that most people have never even heard of. You need to check your eligibility for Medicare Savings Programs, or MSPs. These are federally funded but state-run programs designed to help people with limited income and resources pay for their Medicare costs, and the income limits are often much higher than you would think. There are different levels of MSPs. Some can pay your entire Part B premium for you. That's $185 a month, or over $2,200 a year, put right back in your pocket. Other programs can help pay for your Part A and B deductibles and coinsurance as well. So many people who qualify for these programs never apply simply because they don't know they exist, or they assume they make too much money. You can find out if you qualify by contacting your state's Medicaid office or your state health insurance assistance program, known as SHIP. Finding out you're eligible for an MSP can be absolutely life-changing. It can completely neutralize all the cost increases we've just talked about. It is the single most powerful secret weapon in controlling your Medicare costs. So, to recap the solution, open your annual notice of change, use the Plan Finder tool every single year, and investigate Medicare Savings Programs. These 3 actions form a powerful strategy. So, as you can see, while the headlines about rising Medicare costs can be alarming, they don't have to define your reality. You are now equipped with more than just information. You have a clear, actionable strategy. It's a 3-pronged defense to protect your retirement savings. You know to treat that annual notice of change like a personalized financial report. You know that 15 minutes on the Medicare Plan Finder can be the most profitable time you spend all year. And you know about the powerful, often overlooked, secret weapon of Medicare Savings Programs. These are the tools that shift you from being a passive recipient of rising costs to an active manager of your own financial health. This is how you win the game. The single biggest mistake that millions of seniors make is treating their Medicare choices like a one-time decision. They view it like signing up for Social Security. You set it up when you turn 65, and then you try your best to forget about it. hoping it just runs smoothly in the background. But that is a recipe for financial disaster. Your Medicare coverage is not a set-it-and-forget-it system. It is a dynamic marketplace. Private insurance companies who run the Part D and Medicare Advantage plans have one primary goal: to make a profit. Their business model relies on changing their plans every single year, adjusting premiums, modifying drug formularies, and altering provider networks to maximize their returns. Their goals are not your goals. Your goal is to get the best possible coverage for the lowest possible cost. Because your interests and the insurance company's interests are not aligned, you cannot afford to be passive. You must engage with the system just for a short period of time, once a year. Now, I know what some of you might be thinking. This sounds like a hassle. It's confusing. I don't want to deal with it. I understand that completely, but let me reframe it for you. If I told you that you could spend one single hour once a year, and in exchange for that hour, I would hand you a check for $500, $1,000, or even $2,000, would you do it? Of course you would. Everyone would. That is exactly what we are talking about here. That 1 hour is the time it takes to open your ANOC and run the numbers on the Plan Finder tool. The money you save is just as real as a check in your hand. Think of it like an annual tune-up for your car. You do it to prevent a catastrophic, expensive breakdown on the side of the road. This is an annual tune-up for your financial health in retirement. It's a small investment of time to prevent a major, stressful financial breakdown down the road. Here at the Medicare Compass, our entire mission is to be your guide through this process, to make it simpler, clearer, and less intimidating. You are not alone in figuring this out. The system may be complex, but the strategies to navigate it successfully are surprisingly simple when you know what they are. It's about being proactive instead of reactive. It's about taking one afternoon each fall to secure your financial peace of mind for the entire year to come. So, the final, most important takeaway from this video is this: your Medicare costs are not a fixed expense like your mortgage or your property taxes. They are a variable expense over which you have a significant amount of control. That control doesn't come from complaining about the increases. It comes from understanding the system and taking a few simple, strategic actions every single year. Control comes from knowledge and from turning that knowledge into action. The world of Medicare is constantly changing. New laws are passed, new plans are introduced, and new savings opportunities emerge all the time. To make sure you never miss a critical update, a new strategy, or a piece of news that could save you thousands of dollars, do yourself a favor right now and click that subscribe button and ring the notification bell. It's the easiest way to stay ahead of the curve. Thank you for investing your time with us today. Stay informed, stay proactive, and take control of your healthcare journey.